everyone. It's wonderful to see you all. It's great. It's been such a pleasure and an honor for me to be associated with this incredible conference now, and with Will and Ahmed and other leaders for the last at least 4 years now. And it's such a joy to see all that it's grown into and all that's been accomplished over this very short period of time. And I remember Will when he was just a beginning faculty member walking in through the front door, and now about to be associate professor at Harvard, and really accomplished so much in terms of bringing people together. And what I wanted to tell you a little bit about is a project that we've been working on where this is Will's other life, that not only is he working on bringing everybody together here and trying to change the world, and also an incredible clinical physicist, but he's also an incredible thinker and a scientist. And I think that there's an opportunity now to really change the face of prostate cancer with what he has done. So we're going to talk about a trial that we've been very interested in running and getting off the ground that actually builds on the work that was done in Will's lab. And this has to do, it's an early trial of prostate radiation and smart radiotherapy biomaterials loaded CD40 agonists in combination with a systemic anti-immune or sort of immune stimulator in metastatic castrate-resistant prostate cancer, which is a very difficult disease to treat. There's not really great options for this disease. And I think in Will's vision and mine as well, that this has a real potential for cross-ocean collaboration. So his group's innovation really is quite incredible, and I've been watching this story for the last several years now. He's developed this concept of smart radiotherapy biomaterials, he and his lab. And he's won several awards for this. It's been written up in the Boston Globe. He's getting all these innovator awards for this concept, this idea that you could harvest the immune system in prostate cancer and combine it with radiation to make the immune system fight those cancer cells and really harness it and turn it into a weapon against cancer. And Will's innovation was, if you take this blue side on the left, these blue cells are cancer cells. On the right, just to orient you, these are also cancer cells, but they won't have the smart biomaterial that Will's been working on. But on the left, it does. And this smart biomaterial here releases a CD40 agonist. And what this does, it stimulates the immune system. So it stimulates these antigen-presenting cells to sort of pick up whatever's in the environment and use it to prime the immune system against whatever it picks up. Well, what you need then is radiation, and radiation is really the magic here that adds to this, is that when you irradiate this tumor, it starts to die, it sends off these antigens into the area, and with Will's smart radiotherapy biomaterial that's releasing this immune stimulator, it allows the antigen-presenting cells to pick up those fragments of the tumor, travel through the bloodstream, and then land in a lymph node and activate the rest of the immune system to say, hey, if you see this signal, go out and destroy these cells. And so the activated immune system cells, the CD8 here, now can go back to the tumor and help to destroy the tumor that you irradiated. And that's very exciting. But what's really exciting, what's really magical about this, and what really, I think, changes the whole face of cancer for our patients with metastatic disease, is that you can also take these cells and now attack other cancer cells in the body nowhere near where you radiated. And this, I think, is the whole magic of this response, is that you're going to take these immune cells now and turn them against the tumor cells that did not receive any radiation. Because ultimately, when somebody has metastatic disease, you can't radiate every single site. You can't radiate every little point. And so by using the immune system to attack these cells, we've really harnessed a whole other set of tools. And this concept was so great. It was getting a lot of awards. But what happens actually when you try this in human living, or not in human yet, but in living systems? And Will just sort of went, and his lab kind of worked on this quietly over the next few years. And so here's a mouse. And just like we saw on the last slide, on the left side is a tumor. And we're going to load it with Will's smart radiobiotherapy materials. On the right side is another tumor, and we're not going to load it. So this is sort of a model of a mouse that has metastatic disease. And on the left side, it's going to get loaded and it's going to get radiated. On the right side, nothing. You do absolutely nothing to it. And Will showed me this just a few months ago in my office after he'd been working on it for years. And so what happens here? Well, let's look here. This graph here shows on this scale basically how much tumor growth you have, and on this scale you have time. And so what happens if you do sort of control to this group? So if you do nothing to this tumor, then the tumor grows. What happens if you treat it with radiation? Well, this is the green line. The tumor grows, but less. So there's some control thanks to radiation. If you put Will's Smart Radiotherapy material in there, it grows less than if you do nothing. So that actually has some response. Now, what happens if you put the biomaterial together with anti-CD40, which is the thing that's going to stimulate the immune system? Well, that has even more of a response. But then what happens if you add radiation and the biomaterial and the anti-CD40? Well, this has the most response, which is very good. It's kind of what you'd expect, that if you're going to be putting all these things together on a tumor, it's going to respond even more. Okay, so that's great. And I'm sitting in my office, and I'm like, Will, that's great. You know, you're able to show this effect there on the side that you irradiated. But then he showed me what happens on the side that you don't irradiate. This is the side that you don't touch at all, this green tumor here, which has received no radiation, no smart biomaterial, and no immune stimulant. Well, look what happens. The effect is almost exactly the same. On this side where you've done nothing, the blue is a control, but look at this line here where you put the radiation in on the other side, you put the smart biomaterial on the other side, and you put the anti-CD40 on the other side. The tumor is controlled, which means that by targeting one tumor in a patient, in theory, with many metastatic lesions, you can then harness the immune system to go out and destroy the tumors in all of the other lesions in the body without using, drugs like abiraterone that cost $10,000 a month, and enzalutamide that costs $10,000 a month. And this, first, when I saw this, my jaw was open for about 5 minutes, and we couldn't proceed with the conversation because I couldn't move my mouth at all. And so the excitement then, the whole concept of this, to see it not just a concept, but actually something you could test in a living being and actually see this effect was incredible. And so what we've done now is to put all of our resources into trying this in humans. Basically taking Will's innovation and putting it into a clinical trial. We want to be able to test the safety. We want to be able to dose escalate and find out what's the safe dose in humans and see what the effect will be. We have to be realistic. There is certainly a gap between what you can do in a mouse and what will happen in a human. But to me, this is incredibly exciting. And that's why we're working on this. This is just to show that when you put Will's smart biomaterial in and it slowly releases this anti-CD40, it significantly increases the amount of immune activation compared to if you don't use the smart radiobiological material. And so we think that by basically combining these materials, we can lead to significant responses in advanced prostate cancer, which would be a total paradigm change for these patients. First, we're going to test the safety and tolerability, then the objective response rate, and this is sort of the design. It's like a dose escalation trial, so you have to find the safe dose in humans. But ultimately, it's our vision that this kind of activity, this kind of thing that Will has developed, is something that you could use in other countries with much less resources than the kind of traditional expensive drugs that we're using. And I know Will has had some discussions with Dr. Ngwa, which we're very excited about as well. So I could very much see this as a cross-ocean collaboration, as one of the first, as a way to get this sort of incredible new way of treating metastatic disease into patients. So we're very hopeful. That's kind of where we stand right now, extremely hopeful, trying to get the trial launched, and excited to work with colleagues across the ocean to move on from there. So thanks very much, and I will turn it over to the next speaker, and I'll see you a little bit later tonight.